Welcome to AARP, Arizona Hispanic Connection. Educate. Celebrate. Connect. Arizona Hispanic Connection.
Good morning, everyone. This is AARP, Arizona Hispanic Connection, and we have another very important show this morning. It is called Medicare's ABCDs and the Triple A's. But this is not the American, what is it called? The American Automobile Association? No. It's not that Triple A. The Triple A, by it, we mean the Area Agency on Aging. And this is an organization that a lot of people might not be familiar with, so we really want to highlight it as the place to go when it comes to many programs, but primarily Medicare. And we'll get to that in just a bit. Again, welcome to Medicare's ABCDs and the Triple A's. I love this subject. I've been talking about several issues since 2011, but this is the one that I really like. So we have a very important guests with us today. I'm going to introduce them now, and then we're going to get to the subject because this has a lot of information. So if you're listening, please call your abuelito, your dad, your tia, your compadre, whoever you feel could benefit from this information. Let them know that we are on 1190 AM. And also, we are on Facebook Live at AARP, Arizona Hispanic Connection. And by the way, if you have not followed us on Facebook, please do. AARP, Arizona Hispanic Connection. Let's see. I'm going to go by memory here. So Frank Varela is with us, and you are with the Area Agencies on Aging as a volunteer.
I am a volunteer, yes. And it's a pleasure to be here, David.
How many years volunteering?
It's been 8 years. 8 years now.
8 years. And then you were telling me that you also volunteer for AARP in the tax program?
In the VITA, the Volunteer Income Tax Assistance
You
program.
must enjoy volunteering.
I do. My wife doesn't want me home, so.
Okay.
No, I'm just kidding, just kidding.
So Frank Varela, a volunteer. And then we have, let's see, Alfredo Gonzalez. Now, you are representing the agency, Area Agency on Aging, correct?
Yes, that's correct. Thank you for having me here.
Yes, and we really want to highlight this agency as we move along. The Area Agencies on Aging is an agency that I believe few people know about. They have great programs, and one of those programs that they manage is called the SHIP program, the State Health Insurance Assistance Program, and that's like the place to go for Medicare folks. So we'll come back to you, so welcome.
Thank you.
And then we're going to go to Hina Sanders, right?
Yes.
I thought because of the last name that you wouldn't be Latina, but you are Latina, aren't you?
Yes, I am, and proud of it.
Okay. Welcome, Georgina. Welcome to the show. You represent the side of an agent, of a broker who sells literally Medicare plans, correct?
Yes, that's correct.
Welcome to our show.
Thank you very much.
And last but not least, we have Alfredo Alvarez. Now, you happen to be from either Colombia or Venezuela?
No, I'm from Venezuela.
Venezuela.
Yeah.
Welcome, Alfredo Alvarez, to our show.
Thank you for the invitation.
Now, you are not a volunteer. You are a staff person for the Area Agencies on Aging. They are your employer, correct?
Yes, I work for the Area Agency on Aging, especially for the SHIP program, for
Right.
the State Health Insurance Program for Medicare benefits.
And it is very important to keep pounding this fact that few people know about the Area Agency on Aging. The Area Agency on Aging basically manages many programs, and I'm going to ask you in a little while Alfredo Gonzalez to explain to us a little bit more about the agency. But one of the things that we want to create a link is, first of all, people need to know this Area Agencies on Aging, and especially know that they manage the SHIP program, which is a Medicare counseling program, you could say. They have SHIP counselors, in other words, Medicare counselors. Mm-hmm. Obviously, people can call 1-800-Medicare too.
Yes.
But I feel that that's more of a national number. You are local here. And the Area Agencies on Aging have 8 regions. So we're going to get to that in just a bit. But let's get to the meat of this thing because it is such an amazing subject. So why don't we start by talking about the history of Medicare just a little bit. Let me just start. Medicare was signed into law in 1965. Now, Frank, that was Lyndon B. Johnson, right?
Yes, it was. Lyndon B.
He
Johnson,
signed it
right.
into law.
Right.
And I understand that Medicare was part of the Social Security law, which passed in 1935. But for some reason, this country, from the very beginning, we don't believe in big programs. But for some reason, it passed. And I think it had to do with the Great Depression that hit in the 1920s,
Yes.
early 30s. And that kind of moved the country to say, hey, we don't like big programs, but we don't want this to happen again, so let's pass Social Security. But the medical aspect of the Social Security Act didn't pass until 1965.
Right, exactly.
Perfect. So that's kind of like a little bit of history,
Yeah.
so people to know. Now, let's talk a little bit about terminology. Can we just briefly explain some terms, and then we'll get to explain. We're going to do a comparison between original Medicare and Medicare Advantage, which is a big choice that people need to make when it comes to enrolling in Medicare. So why don't we start with premium? Anybody, what is a premium? We all have to understand what a premium is.
A premium is an amount that a person has to pay to have the right to get that insurance.
So again,
Yeah,
repeat it.
premium is the amount that you have to pay monthly for the right to have the insurance.
So how about what is cost sharing? Anybody? What is cost sharing? The concept of cost sharing. And what I could say about that, and anybody can jump in, is a lot of times it would be great if we just paid the premium and everything was taken care of, right? But the fact of the matter is that after you pay the premium, there is still cost sharing, meaning that the insurance company is not going to pay 100% of benefits. Therefore, the person who is insured is going to have to share the cost with the insurance, right,
Exactly.
Frank?
Yeah. There you have deductibles.
Right. So
that you
that's
pay.
another
That's
word. So
another
what
word.
is a deductible?
A deductible is the amount that you pay before the insurance covers everything.
So the policy will come with the deductible. That means an amount that people have to pay first before the
Right.
insurance starts helping you, right?
Right, exactly, okay.
So this terminology applies to pretty much any kind of insurance. Let's not focus yet on Medicare,
okay,
okay?
okay.
So again, a premium is what you pay on a monthly basis. Then insurance don't pay 100%, so that's where the concept of cost sharing comes in. The cost sharing will have the form of co-pays, right?
That's
Right.
correct. The co-payments are what you share with them, and you pay an amount, and the insurance company pays the other amount. So depending on the co-payments, it's what you're going to pay each time you go to the doctor or to your specialist
Right.
or to any service that you need.
Now, there is a co-pay and a co-insurance. What is the difference between a co-pay and a co-insurance? So co-insurance is more of a percentage of the share of the cost sharing system.
Yeah.
Whereas a co-pay is more of an amount. I think
Yeah.
when you like a visit, you
Yes.
pay a co-pay. Some services may have co-pays, but the co-insurance usually has to equal 100%.
Yes.
So maybe one will pay 80%, the other one will pay 20. Maybe in the marketplace, you have the 60-40s,
Yes.
the 70-30s, the 80-20s, and the 90-10s. Those are the co-insurance, which are basically percentages versus amounts. And I always link a copay to amounts, co-insurance to percentage.
Yeah.
Now, we already said, we talked about premiums, cost sharing in the forms of deductibles, in the forms of copays and the forms of co-insurance. There's another concept that I consider very, very important for people to understand. What is an maximum annual out-of-pocket or an out-of-pocket max? What is that concept of out-of-pocket max?
The insurance set up an amount that is called maximum out of the pocket. That's the amount that you have to pay during the year through your copays. If you reach that amount, the insurance will start paying 100% that you don't have to pay more copay. During the time that you are below that amount, you continue paying your copays for every service.
We could say that that is like a protection, right? There are a lot of people file bankruptcy because of medical bills.
Exactly.
So what the government did is, okay, we're going to force insurance companies to have out-of-pocket max so that if you have a lot of care during the year and you're spending a ton of money, we don't want you to go bankrupt. So each plan will have an out-of-pocket max. If you hit that during the year, let's say you hit it in September,
Yes.
then from September to the end of the year,
Right.
the insurance company will have to pay 100%.
And every plan
afterwards.
has a different maximum.
Right.
Yeah.
Every plan has a different
One thing that's
maximum.
real confusing to a lot of people is when they see that maximum 4,000, they think I got to pay 4,000 before.
Right,
You know,
right.
and it's that. So we always have to explain it's not. You know, if you don't use the money, that's fine.
Right.
You don't have to pay
so,
that.
So that deductible is an amount that you have to pay first before the insurance kicks in.
Yes.
Right.
The out
Right.
of pocket is the amount that if you reach it within the year,
Right.
then from then on you pay zero, and the insurance company
Right.
picks up
and
100%.
that all includes
The
copays and deductibles.
Right. And
the whole
let's
thing.
clarify that. So what is considered out of pocket?
Any money that you actually have to pay, like copays,
With the exception of the premium.
medication. Yeah. The premium.
The
Yeah,
premium does not
yeah.
count.
The premium
medication
doesn't count.
count to the maximum out of the pocket.
Right.
item.
Perfect. Good.
Right.
But
And-
it's very important that anything that comes out of your pocket
Yes,
is considered an out of pocket except the premium, in
premiums.
general terms. And let me just use one more minute to come, and we'll keep coming to you, Alfredo Gonzalez. So can you, in about a minute, just tell us some of the programs that the area agencies have in addition to the SHIP program?
Sure. Let's start off by talking about the senior helpline that we have.
Good.
It is a 24-hour a day, 7-day a week service. It's the way our agency is accessed for any of our programs, including our SHIP program. And that number is 602-264-4357. So if a person really wants to access any service or has any questions, that's the best number to
And
call.
what kind of a service do you offer in addition to counseling, Medicare counseling?
We offer a lot of services, in-home services and supports.
Okay.
So things like home-delivered meals, light housekeeping assistance, personal care help with medication management. We also provide caregivers with respite from taking care of their loved ones in the form of adult daycare or someone actually coming to the home to provide that caregiver a break. We have in-home counseling for people with depression or dealing with life issues through our elder intervention program. We have our ombudsman program, which serves people in assisted living, skilled nursing, and
That's
group
a
homes.
lot of programs.
Oh,
And I'm
yeah.
afraid a lot of people do not know about these programs.
Yeah, we have a lot more programs.
All right, we're ready for our first break. This has been a great first segment just to kind of lay the foundation. We're going to start explaining the differences between original Medicare and Medicare Advantage when we return. Thank you. Stay with us. This is AARP Arizona Hispanic Connection.
Welcome to AARP, Arizona Hispanic Connection. Educate. Celebrate. Connect. Arizona Hispanic Connection.
Thank you for staying with us. This is AARP Arizona Hispanic Connection. I'm your host, David Parra, and I have four very, very knowledgeable guests. We are explaining the ABCDs of Medicare and the triple A's, which again, we refer to them as the Area Agencies on Aging, not the American Automobile Association. But a lot of times internally within organizations, they create names, right? And sometimes they call them the triple A's, you know? But I know it could be confusing, but I just wanted to make that clarification. Again, we are not talking about Medicare from the policy angle. We are explaining Medicare from a user, from a consumer angle, so they know how to access Medicare. We have explained some terminology. Now, let's get to the nitty-gritty. When somebody who has works for an employer, they buy insurance. It's kind of simple. You know, they pay the premium, they get a card, and then they can sign up online to view their benefits and make appointments and find doctors, etc. But when it comes to Medicare, it's a little different. So let's kind of walk through the process. We have mentioned 4 letters. I'm going to put C aside for a while. Let's just think of A covers
Hospital.
Hospitals.
Yes.
B covers
medical
Doctors.
ambulatory services or
Right.
medical services.
You could say the doctors,
The
the
doctors.
medicine.
Doctors,
Right.
the procedures in the clinic,
Right.
specialists, yes.
And then
Labs.
you come to the part D, which
Yes.
is drugs.
Prescription
Prescribed, right, of course.
Yeah, prescription drugs.
Right. So what I was saying earlier is when I bought my insurance, I got hospital coverage, I got medical coverage, and I got prescription drug, but it was kind of simple. I did not separate these things. On Medicare or in Medicare, there's this separation because of different things that we're not going to go into too much detail. Suffice to say that, again, you still get your three main areas of coverage, your hospitals, your doctors, and your prescription drugs. We agree, correct?
Exactly.
Now,
Exactly.
I always believe that it is important to explain this difference between the original or traditional Medicare, which was what was there from the beginning, and then in 1997, there began to exist another option by which people could receive their medical care on Medicare, of course.
Exactly.
And that was through an insurance company. In 1997, when people began to have this second option, that you can now have the option of getting the Medicare, the same coverage, you could say, because by law both have to offer the same thing, then people began to talk about Part C, which stands for choice. Medicare plus choice used to be the name. And then I believe later on, in the 2000s, then they started using the name Medicare Advantage. So now people don't talk a lot about Part C. They use more the term Medicare Advantage. So in summary, when it comes to Medicare, it's not as simple as for me. I just sign up and work, I get my insurance. It says people need to understand these two options because they're going to have to make a decision when they sign up for Medicare. Am I correct on that?
Yes. Yes.
So two options.
Yes.
We're
Two
going to
options.
say original or traditional. These two words are used interchangeably.
Yes.
More original Medicare.
Original Medicare
We call
versus-
them original Medicare.
Yes, versus Medicare Advantage.
Okay.
Let's start to make the difference so that people who are listening understand the two differences so that they can make the choices.
Original Medicare only covers 80% after a deductible.
Okay, so I see then one difference. You mentioned 20%.
Yes.
So in original Medicare, are you saying that the Medicare will only pay for 80% of the medical bills?
Exactly.
And then the beneficiary is going to have to come up with a way to pay for the other 20.
Okay.
So original Medicare only covers 80% of the medical bills. How about the Medicare Advantage?
The Advantage plan is just like a regular insurance from an employer.
So do they
It's-
charge you the 20%?
No,
Let's talk about another main difference.
The big item is that when you're in original Medicare, you have to be, or you're responsible for that 20% without a maximum out of pocket.
Okay.
But when you sign up in a Medicare Advantage, then that 20% has a maximum out of pocket. So that protects you.
So that's another one. So original Medicare does not have an out-of-pocket max.
No.
Versus, no cap. So you're going to have to pay whatever you have to pay versus Advantage. You do have an out-of-pocket max. That is a very important
Yes.
one. Another difference. How about drugs? Is there a difference between the two when it comes to drugs?
Original Medicare does not include the drug part. They enroll you in AARP, and then you have to complete your insurance, the way you want
So
your
they
insurance.
want to buy a Part D,
D.
plan.
They have to
Part
buy
D.
a Part
How
D.
about on Advantage?
Or they have to, instead of buy a Part D, they get an Advantage plan where they get the three parts.
So it
A,
comes
B, and
with
D.
it. Perfect. Okay, so we've touched three differences.
Yeah, exactly.
One, the 20%, you don't pay it in Advantage.
Yes.
The prescription drugs, you have to buy it under original.
Right.
You don't. It comes with it under Advantage.
Right.
And then the out-of-pocket max, on original, you have no out-of-pocket max.
Right.
Whereas in Advantage, you do have, which is good. Having an out-of-pocket max is good. So those are three main differences. Now let's go to another one. What is another big item?
The original Medicare can be used in any of the 50 states.
Ooh, that's a big one.
That's a big one.
The Advantage plans go by county and by network of
So-
providers.
Can we say that Original Medicare has a nationwide network of providers?
Absolutely.
Versus the
Advantage
Advantage,
plan.
which, by the way, it's an HMO.
It's an
Right.
HMO.
Managed care HMO plan with an insurance company,
Yes.
which you don't have the luxury of going to any state of the country.
Yes.
You have to stick to a little network of providers.
in your county.
So now let me ask a question. What do people do to cover the 20% that Original Medicare doesn't cover typically? What do they do? And let's not go into the savings programs yet.
Right. Well, if you there's another part called supplemental insurance.
Okay,
And that-
supplemental
supplemental or
insurance.
Medigap.
Medigap, okay.
Okay, and those they're a little expensive, 150 to 180 to start with, right?
month.
But they do cover everything that the 20%, the deductibles, co-insurance,
Or
everything is
could cover, because there's like
Oh,
11
you're right,
different
you're right.
Medigap plans.
Exactly. There's
Okay, so if someone sticks to Original Medicare, they're going to have to buy a Part D plan.
right.
And then they're going to have to, well, they don't have to, but they
But
could buy supplemental
supplemental.
insurance to cover for what Medicare doesn't
Exactly.
cover.
And there's
if they get the top Medigap plan
Plan F.
probably it's going to cover most of it, if not
everything.
all.
Exactly.
Now,
Exactly.
can people buy supplemental insurance under Advantage?
No.
Oh, wow.
You got to have one or the other.
You can have one or the other.
So what is the philosophy behind the fact that you cannot buy Medigap under Advantage? What is the philosophy behind it? Let's get a little closer
What
to it.
I like to say to my clients is, when I start explaining Medicare, I tell them you have three options. The first one is stay with Original Medicare, and you're going to be responsible for that 20% that Original Medicare doesn't cover. The other option is that you can get a supplement plan that's going to cover, if not all, almost all of their co-payments and deductibles that Medicare doesn't cover. And the other option is that you have the Medicare Advantage plan. And the difference between those two is, with the Advantage, you probably won't have a premium or have a really low premium.
Well, we should say additional premium.
Yes, additional premium, but with the supplemental, you're going to have a more expensive premium to pay depending on the plan you get.
So let's talk about money. So can we say that under Original Medicare, you're going to be paying roughly $300 a month versus about $135 in Advantage, and what you are really giving up is the ability to go to any doctor.
Exactly.
If you go with the Advantage, you have to stick to a network. If you go with the Original,
Right.
you have to. You can go to any doctor. Sorry,
If they accept Medicare.
that accepts Medicare in any state of the country. Now, if you have Advantage and you are in, like my parents, they're in California. When they come to Arizona, what if they have an emergency? Are they going to be covered?
Yes.
Advantage program covers you out of your area of network
Okay.
only for emergencies.
Emergency.
So if you
and
are
it better
out
be
of-
an emergency, right?
If you are, yes, if you are in California and your plan is from Maricopa, you can only use it for an emergency in a hospital.
Okay. Now, are you satisfied that we did an adequate job in explaining the difference? Because this is exactly what confuses people, and this is what they have to choose, no matter what. And sometimes, when you work counseling people, I'm sure they tell you, well, just select the one you think is
Yes.
best for me. And you said, no, you have to choose. So the beneficiary has to select the plan out of these two options.
One of the things that we do in the program is just give the beneficiary the tools,
Of course.
so he can understand the plan comparison and he can make his own choice.
So you help them to do
what
a
we
plan
do is just
comparison.
explain what item means and what the comparison of the difference of prices between one insurance and the other.
Perfect.
But we don't make choices for them.
Of
It's their
course.
own choices.
Good.
Right.
Want
And
to add
one
anything?
other thing, for the Advantage programs, a lot of people, what Medicare does when someone signs up for an Advantage program, they pay that plan or that company a certain amount of money. Okay, so in other words, the way I like to explain it is Medicare says, okay, you're part of Humana.
Right.
That's it. Don't come to us. If you go outside of the
Once
network,
they move to an Advantage plan, they're no longer under Original Medicare.
Exactly.
Who's managing their care now
Exactly.
is the insurance company.
right, and Medicare pays them a
Right.
certain amount of money. So I said, okay, you're their problem now.
Perfect. We have to go on break. This is so good. You're listening to AARP, Arizona Hispanic Connection. We'll be right back.
Welcome to AARP, Arizona Hispanic Connection. Educate. Celebrate. Connect. Arizona Hispanic Connection.
Thank you. Thank you for staying with us. This is AARP Arizona Hispanic Connection. We are addressing a very important subject, and it is called the ABCDs of Medicare. I'm glad we can speak about this issue because sometimes it could be very confusing. Before we continue with the subject of Medicare, I want to I want to give an opportunity once again to Alfredo Gonzalez from the Area Agencies on Aging. I am such a believer in this agency that at any cost, I wanted them to be represented in this show because I have a feeling that a lot of people do not know about the Area Agencies on Aging. They offer such great services. Obviously, just one of them is the SHIP program, which is literally a government program, but it's run by the Area Agencies on Aging. Then SHIP program stands for State Health Insurance Assistance Program, and it's a counseling program. So, Alfredo, help us understand a little bit more about the Area Agencies on Aging.
And they cover the various counties. Our agency itself, we're the biggest in terms of population. We cover all of Maricopa County, but there's some that are more rural that will cover a number of different counties.
Perfect. And once again, is there a number or a website that is very generic so that if someone's listening in Tucson, someone's listening in Douglas or Yuma, that they can go to find the Area Agencies on Aging, and then later on, or that through that website, they can find their region?
Yes, that website is actually www.eldercare.gov, and that website, by putting in either a zip code or the city that you live in, it'll give you what Area Agency on Aging serves that area.
The website again?
www.eldercare.gov.
Thank you so much, Alfredo. So we understand that there's a lot of people who have a very limited income. So when it comes to Medicare, as we said earlier, no insurance company covers 100%, so there are cost sharings. There are cost sharing in the forms of copays and coinsurance after you meet the deductible. So are there programs of assistance financially that help those Medicare beneficiaries who have very low income? Are there programs, and what are they, and how do they work?
Yeah, there are public assistance programs in Arizona and in every state that will help low-income Medicare beneficiaries. The Medicare Savings Program is a program.
Medicare Savings Program.
Yes.
Okay.
It's a program managed by Access.
Okay.
And they work only with the clients that have Medicare and Medicaid or Access.
Okay.
And they can help you you can get dual eligibility and have Medicare and Medicaid at the same time.
It is possible to have then
Yes.
Medicare
at the same time.
Medicaid, which in
Yes.
Arizona is Access at the same time if your income is at a certain level.
Is below certain level.
Perfect. How many Medicare savings programs are there? I hear people say the Quimbys and the Slimbies and the QI1s.
Right.
So
right.
Quimbys, Slimbies, and QI1.
Yeah, I'll start out with
Go ahead.
QI1, and that's for people that'll pay the Part B premium, and it's for people that have a couple less than $1,800 a month. $1,847, right? And then there's another one called the Slimby, which we can have a little bit. If you have a little bit less, you also get automatically receive LIS, limited income subsidy, which covers medications.
No.
If you qualify for Q1 or Medicare Savings, it automatically enrolls you in the Extra Help program, which also covers for medications.
Got it.
Right.
So again, these two programs, at the very least, the QI1 and the Slimby, so-called, will cover at least the Part B premium. So if somebody, instead of deducting Social Security, deducting $130+ from that person's Social Security check, now they can keep it, and then Access will cover the Part B premium.
Exactly.
Now, is there another program that is even better than these two?
Well, the QMB.
The Quimbies?
Quimbies.
Okay, and what is that?
Go ahead, Alfredo.
The Quimby is for people whose income as a single is $1,000 and below $1,025. And if you are below that limit, you qualify for Quimby. It means that you are dual eligible.
Right.
You have the right to have Medicare as a main insurance and Access as a secondary insurance. Access will pay all the 20% from the Medicare, and also you are going to have a lot of benefits. So that person will pay zero.
Being the Quimby beneficiary will give you, again, Alfredo, so you're saying they'll pay your Part B premium
Yes.
and literally pay you for pretty much everything.
Everything.
Plus, they'll even pay.
The only thing that you will pay will be medications and in a small amount.
$2, $3, $4, $6.
$120 for generic and
Wow.
$320
Yeah.
for brand.
So a lot of people, many people have both Medicaid and Medicare with the Quimby program, which is the top.
Yes.
They'll pay the Part B premium. They pay pretty much everything.
They'll also pay Part A premium if it's applicable.
Georgina, you do sell insurance. Who do you deal with primarily when you sell insurance? Yeah.
We usually talk to and visit a lot of people, and when there are duals, that we say they are duals because they have the Medicare, the Access and Medicare, they have a lot of benefits, extra benefits that they sometimes don't know they have it, like dental, vision, chiropractor.
So you have way more benefits than just what the Medicare includes. It includes the Access benefits as well.
Yes. And a lot of people don't know that they are in original Medicare, and they don't know that they can apply for these programs.
Wow.
And sometimes they're afraid to ask somebody to help them. So I will invite them to call us and tell us, can you figure out if I'm eligible to be a Quimby or a Slim
Right.
B? Because that's going to be beneficiary for them.
So lots of information, but people don't have to figure it out for themselves. That's why the SHIP program is available for you at the area agencies and agents. It is extremely important that the community knows about the area agencies and agents. Of course, brokers and agents, they sell insurance, and it is not a sin, S-I-N, to buy insurance from brokers.
No.
It is not a sin. They're just available for you. They know all the information. They're regulated. They have to tell you all the facts as well. So that's another option.
Yes, and I want to tell them that don't be afraid. Call us. If we're agents or brokers, one important thing that you have to know that you don't have to pay us a cent.
That's important. So you don't make money from
No.
the beneficiary.
No, we
you
don't.
Get commission
and we
in other
don't
ways.
charge a cent
Good.
to
Good
help
to know.
you and explain to you how does this work. So don't be afraid.
The agents represent typically one company, two companies, three, all of them, or it varies?
Some people, some agents represent only one carrier. But as brokers, like, for example, I'm a broker, I represent different companies. So I can have a more expanded information about the different companies and try to figure out what's the best company for you to go depending on your issues individually.
Thank you. Now, let me say this, that a lot of times, I think it's important to understand that almost everyone can buy Medicare. Because what we pay in taxes, 1.45% for Medicare, and then we also, in parentheses, 6.2 for Social Security. And obviously the Affordable Care Act added 0.9% for those that make a lot of money. That percentage that we pay for Medicare only applies to Part A.
Exactly.
It's important to understand that. You're not getting Medicare, the full enchilada, as we say. You're only getting Part A premium free by paying the FICA tax.
Exactly.
But also, if someone doesn't have the 40 credits, we have explained in the past that by paying the FICA tax, you accrued 4 points or credits per year. In 10 years, you accrued 40 credits, 40 quarters, and that makes you eligible for Social Security and benefits. Now, you're going to get Part A premium free. But if you don't have the credits, can you still get Part A?
You can get Part A, but the premium is high. You have to buy it. It's like $440 a month.
Extremely expensive.
Yeah. But the Quimby people, that gets paid automatically for them as well.
There is another possibility for a person who didn't have, because there are different prices. You have from 7.5 to 10 years of work, your premium, it won't be the whole price. It will be half of the price.
Got it.
But if you don't have the 40 credits, you can sign during the general enrollment period
This is
for
the next
conditional Part A.
Right.
And if approved by Social Security and Access, then your Part A will be paid. The premium will be paid for Access. But
So-
you have to request it conditional.
And they need your help.
And they need our help to do that.
And one other position too, if you stay married, if you last that long with somebody, okay, and you don't have enough credits, but based on your spouse's credit, you can also
That's
get Medicare.
important. So
Yes.
you don't have to have the credits, but you could get the benefits if you are the spouse of someone who
For-
has the
for
40
10
credits.
years.
We have to go on our last break. This is AARP, Arizona Hispanic Connection. We'll talk about the enrollment periods next. Stay with us.
Welcome to AARP, Arizona Hispanic Connection. Educate. Celebrate. Connect. Arizona Hispanic Connection.
Thank you for staying with us, and we apologize for going so fast. This is an issue that has a lot of information, and we've tried to summarize it for you. Again, this is AARP Arizona Hispanic Connection. We are addressing the ABCDs of Medicare and the AAAs, meaning the area agencies on aging. We have region 1 through 8. We have 8 regions in Arizona, but all the states of the country have the area agencies on aging. So you can definitely, whatever state you're in, you can find the region where you live. And that region or the area agencies on aging, they have all kinds of programs. And Alfredo Gonzalez have been helping us to understand some of those programs. And among those programs is the SHIP program, which is a government program that is basically run by the area agencies on aging. So you basically get funded by the government to run this program. Alfredo, one more time, how can people get a hold of the area agencies on aging in whatever state or I should say region they're in Arizona?
The best way to find out how to contact your local area agency on aging is by going to the www.eldercare.gov website, and they will be able to find their local area agency by putting in either a zip code or the city that they live in.
I believe every person hearing us today, everyone in Arizona, has to know the area agencies on aging, especially if you have grandparents, parents that are getting to be Medicare age, and they have just so many programs that it's unbelievable. So please look them up. Let's use the rest of the time that we have to talk about the enrollment periods, penalties, and all that kind of good stuff. Let me start by saying this, and I was just there in San Luis, Arizona, Nogales, and Tucson, giving literally a conference, and one of the issues was Medicare. And I tell people that when they turn 65, 3 months before, they go to Social Security, they sign up for Medicare, they get on the mail 2 weeks after that the Medicare card. It only has A and B, and I tell people, your enrollment is not complete. Please understand that when people go to the Social Security office, get their Medicare card, your enrollment is not complete. I was just on the phone with a couple of people yesterday. Your enrollment is not complete when you leave the Social Security office. So what has to happen next? And this is actually the initial enrollment period.
Exactly. And if you are receiving Social Security already, like you start at 62, you automatically get enrolled in Part A and B. So you're going to receive in the mail your Medicare card, and people
do not need to worry about enrolling in Medicare if they're already on Social Security.
Exactly.
That's a great thing.
Yeah,
how about those that do not?
Those that do not.
Or
Now,
are not.
if they have enough insurance, if they're working, for example, okay, and they have insurance through their work and they get to be 65, okay, they're not required to sign up unless
repeat that. This is a so critical point because a lot of people think that they're confused. I get the calls, and you do too.
Yeah. Yeah, because they're working, they're not receiving Social Security.
They turn 65, they're still working, and they have employer-based coverage.
Exactly. In that point, you don't have to, unless an employer requires you to sign up for Part A because it's free, okay? But a lot of people make the mistake and sign up for Part A and Part B, so now they got to pay the premium for Part B and still have the employer insurance.
So they basically paying premium twice
Exactly.
if they sign up for Medicare.
So they don't. If you do have minimum essential coverage, then you do not have to sign up. But once you retire, you only have a certain period where you do have to sign up for Medicare.
8 months, I understand.
Right,
So
right.
you have to have employment and insurance linked to the employment,
Exactly.
and you will not be penalized if you
Exactly.
sign up late. And something real fast: those that sign up for Medicare and are not receiving Social Security benefits, they will be billed on by 3 months. Correct?
Yes, they will bill the premium for 3 months, and the premium will move what the cost of the next year. Like this year is 134, and next year is 145, for example. We don't
Right.
know exactly. They will start paying next year that amount.
And then
if you get it deducted from your Social Security, you lock the price.
Okay.
The premium.
You lock the price.
Your, your increase in the premium will be
Lower. Okay.
So you keep more or
That
less
is
the price.
very, very good.
The person that pays cash
very good point.
increases. They get the premium
year.
that is every year.
Okay. So the penalties. What are the penalties, Georgina? Are you familiar with the penalties? I'm sure you are, right?
So you have to be enrolled, and you have to understand that you have to be enrolled. I get some people that say, "Oh, I don't want to pay Part B," and they don't enroll, and then later
What's the
on,
penalty?
The penalty is going to depend if you got your Part B in time and your Part D.
So there's
also.
only penalty for B and D. Okay.
Yeah, the
And A?
medication.
There is also penalty
Yes.
in A, but it's less common.
Okay.
And
let's
it
come.
only lasts a short period of months, like
Okay.
4 months or
Yep. Yep.
for every year that you didn't have something like that, but then goes.
So-
the other ones are
for life.
In addition to money penalties, or let me come back to
Yeah.
you, Georgina.
Yeah.
We need to hear your voice more. There's another penalty regarding enrollment. What is that?
Yeah, the enrollment period is you have to be enrolled. Well, when you turn 65, you have the 7 months window to enroll. 3 months prior to the month you turn 65, and then 3 months later. And you have to be enrolled in that time. If you don't get enrolled, then you're going to have a penalty, especially if you don't have Part D, because those penalties are going to be for life. It's not going
Yeah,
to
but
be
that's
for an
that's the
amount.
money penalty. How
Right.
about the time when you can enroll? So if you incur a penalty,
Right.
you didn't enroll within the 7 months, when can you enroll?
You have to apply for your Part A and your Part B like in months from January to March.
So that would be called the
General
enrollment
for-
period.
yes, for
and,
Part A and B.
and it doesn't start until
Until-
July.
So
Yes.
you have January to March to enroll, but then
Right.
coverage starts in July. So you're
Exactly.
not only were you penalized money-wise, but you're being penalized in the time that your coverage is going to start.
Exactly.
So at the very least, more than 6 months.
Yes, definitely.
Wow, that is important.
I'm going to clarify something about SHIP and Medicare, because people has called sometime the program saying, where is the closest Medicare office? So SHIP, the program SHIP exists because Medicare does not have offices open to the public like Social Security or Access.
Got it.
So we are the Medicare offices. So when people call, they say, I need the local offices. There's no local offices. There are the SHIP offices where you can come get the help from Medicare. Or call Medicare 1-800, which will take you during the open enrollment several hours waiting for
Right.
someone
I
to
know
talk.
you guys don't like me to say this, but I don't care. I'm going to say it anyway. I always refer to you as the AAA of Medicare.
Yeah.
I know people are going to get confused. Area, agency, and agency.
Yeah.
Remember that. You're familiar with the AAA concept with the cards. Now just add the
Right.
AAA of Medicare.
Yes.
The area agencies and agent. I'm telling you, every single person has to know about the area agencies and agent. And that's
Exactly.
why I communicated with Marco Mendoza, who is
Yes.
it the director of the
Yes.
SHIP program for the area agencies and agent. If you are
Exactly.
listening, Marco, we te saludamos.
You
but
and Toby.
said
Morning, Marco.
we needed someone from the area agencies and agent to be here, and we're going to give you for one more shot, Alfredo. You represent. You don't work for with the SHIP program. You work for the agency, correct?
Yeah, that's correct. I work for the senior helpline at the area agency on aging.
Now, do you get a lot of calls, and what type of calls do you get at the senior helpline?
Yeah, we get a wide variety of calls. Anything, just about. We get about 40,000 calls a year.
Wow. And then you direct the calls to whatever program they are inquiring about?
We do. We connect clients to any of the agency's programs. We also sometimes talk to them about resources outside of our agency because a lot of the clients call for stuff we don't do.
Yeah. Okay, 3 minutes, 2.5 minutes. Let's just conclude. Frank, go ahead.
Okay, what real important thing is for everybody is if you're going to be 65 3 months before, contact the agency because no matter what, it'll take 5 minutes. We can explain what you need to do if you're working or not working. And it's great. It's a great agency.
Let's take 30 minutes, Frank. You are a volunteer,
Yes.
and I am aware. I know the area agencies because I live in Maricopa
Right.
County. You need volunteers, Latino volunteers.
Latino volunteers
like
especially.
Many of them,
yes,
right?
Yes, and it's a great program. It's one of the best programs that I've ever
So they
volunteered
basically
for.
become familiar with how Medicare works, and they become
definitely.
counselors,
They
just
become
like a staff person.
Exactly.
Right?
And you go through lots of training, and we have great instructors, and it's just great. It's a great way to give back to the community, especially to the Latino community.
Have you managed to get bring in another volunteer yet?
Yes. I've
who's
had
that?
at least 2 of them. They weren't
Latinos?
non-Latinos,
Okay.
darn it, unfortunately. But
Let's keep working
you
at
know,
it.
and it's confusing enough in English. So once you go to Spanish and Latino, it's even harder.
Right.
And the kids, their kids are not interested in Medicare, so the parents don't get that.
So they don't get the support
they
necessarily
don't get the
from their
support,
children.
and that's important. So that's why it's important the Latinos.
Last things in your mind before we go. Oh, by all means, Alfredo. You don't have to say that. You can shout it out.
I just want to remind every Medicare beneficiary that tomorrow is the first day of the open enrollment period. Is the only period where you can do changes to your Medicare. So it goes from October 15th to December 7th. You can contact the agency at the SHIP program if you need help modifying your enrollment.
10 seconds, Georgina.
Okay, well, my name is Georgina Sanders, and I work all of the Santa Cruz, Pima, and Maricopa area. And if you need help, I'm bilingual. I speak English y español también. Yo los puedo ayudar. I can help you. You can give me a call, 520-223-3601, and I'll be happy to help you.
Thank you so much for joining us. I just want to say that there's a lot of people still who don't know about this show. I'm asking you to spread the word, and primarily that you ask people to follow us on Facebook. This is AARP Arizona Hispanic Connection. We're going to be addressing so many important issues. So I want to thank you. Have a great day. This was AARP Arizona Hispanic Connection.
Arizona Hispanic Connection.